Before we start this meeting, we will just run through what happens in a case of an emergency. There are no planned fire drills during this meeting. If you hear the fire alarm sound, please treat it as a real emergency and evacuate the building via the nearest safe escape route. The nearest escape route is via the stairs to your left as you leave the council chamber or public gallery. Exit via the door at the back of the building and walk across the inner car park to the evacuation point, which is the pavement opposite the police station. The lifts can't be used in the event of an emergency. Please do not re-enter the building until you're advised it is safe to do so by a member of staff. Apologies so far. We have had apologies from Councillor Nicholson, Councillor Price and Councillor Andre. Councillor Redrup will be here, but she couldn't get here until a little bit later, but she will be here. So the Vice Chair will be here. And I'm glad to say that we are now for it. We have had no apologies from Councillor Gladwin. She will be here. Okay, thank you. Declarations of interest. Has anybody declarations of interest of anything on the agenda? No. We have no public questions. We do have, we don't technically have any members' questions because the members' question that was sent in late, but there are a couple of bits, having read through this, that I will bring in as part of when we are discussing those items in the agenda. So the one thing that I would like to start with, if that's possible, before and taking up a little bit of the members' question time, is a thank you to the committee. It is going to be a journey until we all work out exactly the difference between cabinet system and committee system. But one of the things I'm trying to do as chair is be really inclusive so that everybody feels that they are part of this decision-making process. So so people don't think we just turn up here on the day as the committee. We have started when press releases are coming out. It used to be signed off by a cabinet member. What I'm doing now is sending it to all of the committee, so with deadlines, because there's some press releases that we can't hold back, but hopefully all the committee are receiving those press releases and have all put valuable input into those, and we've been able to feed that back to the media team. So I think as a part of making sure that people know that we are being open and involving everybody, that's what we've already started to do as these committees. So if there is anything that comes to me, we have now got a set email that covers all the committees. So as long as the committee are watching their emails, they should be involved with every part of the process. So I hope that enlightens people into what we're doing behind the scenes, that we're not just, I think it will be very easy to run this as the old cabinet system, but we need to make sure that we do run it as a committee system. Just to remind everybody that this committee is now a decision-making committee. I think that's the bit that people are going to have to get used to, that this committee is to sit to make decisions that a cabinet member would have once made. So you have a huge amount of responsibility on your shoulders sitting on this committee. There will be a level of expectation from everybody to have read the papers and have a level of understanding of what you are being asked and discussed. And I think it's good that it's being done in an open and transparent way. But we do have to remember we are not a scrutiny committee anymore. We are actually, as an old cabinet member, a decision-making committee. The first part of this meeting will always be open to outside bodies. So we will have our health scrutiny side, which we used to have as corporate scrutiny. So the first part of this meeting will always have outside bodies coming to it. We will have meetings outside this meeting to discuss who we think should attend. I did have a meeting recently because we had a very short space of time, a window to put this agenda together. So we did decide between myself, Simon Bryant and Laura Gordian, that the most pressing priority at the moment was to invite the members of the Integrated Care Board along to come and talk about the new blueprint. I know we've seen lots of stuff in the media at the moment about what's happening to the hospice. It is something that's very emotional to most people who are resident on the island. But you also have to remember that is not just what the Integrated Care Board it is about, but we do have some pressing questions about that as well. One of the other things we have done as a committee is we have invited Healthwatch to be a permanent, non-voting, but a permanent member of this committee. I think we can all accept over the years that Healthwatch's, views and being the voice of the people has been absolutely invaluable, and it's something that we didn't want to lose as this committee. So thank you, Joanna, for joining us, and you've said you to join us at each meeting, haven't you? Or somebody else from your team will come and join us. Thank you. So the members' question, because it was late, there are parts of it that are actually quite useful for other parts of the agenda, so I will bring those members' questions in. The email was from Councillor Jarman, so I will make sure that those questions do come on those parts of the agenda that are relevant. Right, I'm going to hand over to point 5, which is health scrutiny. To consider the following items in accordance with the committee's statutory health scrutiny function, the draft Maldor Integrated Care Board blueprints, which was pages 5 to 10. I'm assuming that all the committee have read this, and to assess the impact of the new Integrated Care Board ICB blueprint on Blue Island residents following the recent changes to the ICB, which, if for anybody listening in, is the Integrated Care Board. I see we have Ross Hartley here. I think there's somebody else from the trust as well. Would someone from the trust like to, or from the ICB intending to speak first? Ross is going to. Yeah, Ross is going to speak first. Thank you, Ross. I hand over to you. Is that okay?
Thank you so much, Chair.
We can't hear you at the moment. Hold on.
Shall I speak again?
We can now hear you. I'm saying Ross because I'm trying to but it is, I assume it's Ross.
It is Ross. Thank you so much, Chair. So you can hear me, can you? Can you hear me?
Try again, Ross.
Well, can you hear me?
Yes.
Okay, that's a yes. If you can't, I think that's Simon. Simon, will you let me know if you can't hear me? So I'm joined. So hi, everybody. I'm Ross Hartley, Director of Partnerships at the Integrated Care Board across Hampshire and Isle of Wight. And I'm joined also by my colleague, James Roach, who we can both answer some questions after I've quickly taken you through the paper, if that's okay. Is that okay on format, Chair?
Yes, that's fine. Thank you.
Perfect. So I will take the paper as read, but I just want to summarise where the paper is, if I may, please. So nationally and locally, there's significant change in the way the whole NHS is organised. And in March earlier this year, it was announced that the role of integrated care boards would change alongside the abolishment of NHS England. And the whole point of this is to reduce duplication and to be more efficient. And this is about reducing running costs, so the costs of some of our corporate services, not reducing services. So it's about reducing the costs. All integrated boards across the whole country have to reduce their budgets, their running cost budgets, to the target of £18.76 per head of population by December. And that's approximately a 50% reduction in our running cost. And in order to do that, everybody has now got a national model blueprint, which we've summarised in the paper. That came out in May, and that outlined what functions the ICBs should focus on and what functions they should focus slightly less on. And in particular, the key things, the key roles of an integrated care board going forward are to really understand the local population, then develop the strategy to meet the needs of that population, ensure the resources, the money, the services are in the right place, and then to check it works and look at the impact. So in the paper, it outlines some of the functions that we really need to make sure we've got in place to do this. We've got lots of these in place at the moment. It's how do we really focus those more going forwards, and some of those services we won't be focusing quite as much on. So for example, we need to focus more on population health skills and how we really look at health inequalities. The paper also outlines those things we have to retain, those things that we absolutely have to do around governance and quality management, finance, procurement. And there are some things that are also in that list in the paper that we will eventually stop doing, and those functions will transfer elsewhere. That may be to the Department of Health, it might be to our providers, it might be to wider partners, or it might be neighbouring organisations. So some of those things are around our provider performance, but some things around workforce planning, community continuing healthcare. So I just wanted to pause there, but then also say nationally, the picture is that currently there are 42 integrated care boards around the whole country. And with these changes, it looks like that will reduce to about 27. For us, we are continuing to work on the geography of Hampshire and Isle of Wight. With the addition, we are proposing that we additionally take on the population of North East Hampshire. So that's an additional population of about 176,000. And we're really, really keen on doing that because it really aligns with the whole of our geography, with our population that we serve, and links and is coterminous with the devolution proposal and local government reform. So I just wanted to say that is something that we're absolutely doing. So I think for us, just to really summarise, there are lots of changes. There are lots of uncertainties for our staff because we will have to reduce. And the pace of change is really quick because we have to do this by December. So I think the most important thing that we have to do is how we continue working with our partners, both locally on the island and around our geography, with our neighbouring geographies, with our providers and all our local government colleagues. And it's a real opportunity for us to maximise on, because even though these are big